Hello students, I am Dr. D.N. Shrienitha, Assistant Professor from the Department of Public Health Dentistry from Vinayaka Mission Sankaracharya Dental College. I am here to introduce a topic regarding finance in dental care. Coming to the introduction part, health services traditionally have been provided on a fee for service basis whereby the patient receives specific services and pays the provider for them directly. And coming to the mechanism of payment for dental care, the various payments for dental care includes private fee for services, post-payment plans and private third-party prepayment plans, which includes commercial insurance companies and non-profit health service corporations, which includes Delta Dental Plans and Blue Cross or Blue Shield, and prepaid group practice including health maintenance organization and independent practice associations and salary and public programs. Coming to the private fee for services, it is a two-party arrangement. It is a traditional form of reimbursement programs, and in 1970 nearly 90% of payments was in this manner, which includes two-party arrangement, dentist and patient. But by 1988 they dropped to 55% of all payment because growth in various forms for prepayments. And this is the first two-party arrangement which includes private fee for service. Coming to the advantages and disadvantages, it is a simple and acceptable format, and it is also flexible for the dentist. In case of price discrimination, it is a Robin Hood approach only under this system where the expensive form of treatment will be provided. Coming to the disadvantages, however, despite the flexibility and the price discrimination, there are some still potential patients who cannot afford dental care. These are the advantages and disadvantages. And coming to the next part, that is post-payment plans. It is an budget payment plans. It is not a third-party financing plans. The dentist allow the payments for dental care to be made at intervals over a period of time. And under the budget payment plans, which includes the patient, dentist and the financial institution. And the patient will borrow the money from the bank or the financing company to pay the dentist at the time he received the care, and then the patient repays the loan to the bank, which includes the patient, dentist and financial institution. And coming to the disadvantages of post payments are that mostly we used by middle class people, as low income patients were not considered as credit worthy by lending institutions. And a private third party prepayment plan, it is defined as it is a payment services by some agencies rather than directly with the beneficiary of those services. As the party to the dental prepayment contract that may collect premiums, they assume that the financial risks and they pay the claims and provide the administrative services. Here the dentist is the first party and the patient is the second party, and the administration of that finances is the third party. And also they are called as the carrier, insurer, underwriter or the administrative agent, where the purchase of that particular plan is that their union employer welfare fund or a governmental agencies will be providing the third party payment plans. And the term third party, here it is referred to as private carriers such as an insurance company and the public financing of care when the government act as a third party. In that, the private third party plans, periodic premiums are collected to meet the cost of the providing care as well as the administration cost of the third party, which includes here the patient, dentist and financial institution. And coming to the insurance part, it involves a group of people making small payments in order to cover the risk of few suffering catastrophic loss, such as they lost the home through fire. And the dental prepayment is that it is a mechanism to spread the financial load of dental care over a group and over time. What are the principles of insurances? To be insurable, a risk must be preciously definable and it must be a sufficiently magnitude that if it is occurring, it constitutes a major loss, and it must be infrequent and an unwanted nature, such as they lost their home through the fire or be beyond the control of that individual. To get around these problems, the insurance is coming with the help of detectable, co-insurance and group insurance. Deductible is that it is a set amount of money that the patient must pay towards the cost of the treatment before benefit of the program go into effect. That is front end payment for automobile insurances. The co-insurance is that means that the patient pays a percentage of total cost of treatment. If the patient is paying 20% of the daily cost of hospital care, the amount of the patient must pay will vary depending on the actual hospital charges, but in any case it will be 20% of those charges. And reimbursement of dentists in third party plans. The major forms of third party reimbursement currently in use are that usual, customary and reasonable fee, and also the table of allowances. What is the usual, customary and reasonable UCR fees? That usual fee, the fee that an individual dentist most frequently charges for a given dental services. That is, the individual dentist, they are treating their patients and they are getting charges from that particular patient. Customary fee, the fee level determined by the administrator of a dental benefit plan from actual submitted fee for a specific dental procedure to establish the maximum benefit payable under a given plan for that specific procedure. And reasonable fee is that the fee which is charged by the dentist for a specific dental procedure that has been modified by the nature and severity of the condition being treated and by medical or dental complication or under any unusual circumstances, and thereby it may differ from the dentist's usual fee or the benefit administrator's customary fee. And coming to the Delta dental plans, it is a dental service corporation. It is a legally constituted not-for-profit organization that negotiates and administers contracts for dental care incorporated on a state-by-state basis. It is a National Association of Dental Services plan which was formed in 1966 June with the help of ADA. The reimbursement of dentists in Delta dental plans includes it is an exclusively by the UCR concept. Reimbursing depends on whether the dentist is participating or non-participating in the dental plan. The participating dentist, any duly licensed dentist with whom a Delta plan has a contractual agreement to render care to covered subscribers. The rules of Delta dental plans is that in Delta dental plans, the dentist should agree in the following. There should be pre-filling of their usual and customary fees and acceptance of payment for their services at that 90th percentile and fee audit by the auditors from Delta who may check their office records from time to time, and post-treatment inspection of randomly chosen patients, withholding of a small amount of each fee, the usually less than 5% to go into Delta Capital Reserve Fund. And also the non-participating dentist who can also treat the patient which is covering under the Delta plans, but they are reimbursed at a considerably lower percentile, that is the median or 50th percentile. And coming to the Medicare, the Medicare is that it is also the 1965 Social Security Amendment Program. It has two parts, Part A and Part B. Part A is hospital insurance and Part B is voluntary supplemental medical insurance. The dental segment of Medicare is limited to those services who is requiring hospitalization for their treatment, usually surgical treatment for fractures and cancer. And Medicaid is that it is also the title of that Social Security Amendment of 1965, and it is a joint federal state program with the federal government and the state government. They are sharing their cost in between them, where the federal government provides 50% to 83% of the funds used by the each state according to a formula that is based on ratio of per capita income in the state to the national per capita income. In order to qualify for the federal government share of Medicaid financing, every state cover a set of basic services for everyone who is receiving federally supported financial assistance, and the states offer early and periodic screening, diagnosis and treatment, the so-called EBSTD program, to needy children at least to age 18, and the dental care is mandatory under the EPSDT program. And the third parties in India, which includes government, Life Insurance Corporation and General Insurance Corporation. In government, which includes Employee State Insurance Scheme and Central Government Health Scheme. In General Insurance Corporation, the Natural Insurance Corporation, New India Insurance, Oriental Insurance Company and United Indian Insurance Corporation. And coming to the Central Government Health Scheme, it was introduced in 1954 in New Delhi to provide comprehensive medical care to central government employees and their families in 320 separate disciplinaries for the employees covered by the scheme. And coming, what are the covers? Central government employees, retired central government employees, widows who is receiving pension and members of the parliament and ex-governors and retired judges. And facilities under this schemes: outpatient care through the network of disciplinaries and supply of necessary drugs and laboratory and X-ray investigation, the domiciliary visits and hospitalization facility at government and private hospital. And specialty consultation and pediatric consultation including immunization, antenatal, natal and postnatal care, emergency treatment, supply of optical and dental aids at reasonable rates and the family welfare service. An employee state insurance scheme. It is established in 1948, which provide both the cash and medical benefit. It is managed by Employee State Insurance Corporation, a wholly government-owned enterprises. These schemes cover non-power using factories employing 20 or more members, power using factories employing 10 or more persons, and road transport establishment and newspapers establishment and cinema theatres, hotels and shops. Only employee earning basic salary of less than 3,000 recently enhanced to 6,500 are eligible, and the premium are paid through payroll tax of 4.75% by employer and 1.75% by employee. Thank you for watching my class.